Hi everyone, it's Dr. Ali here from Bustleton Vet Hospital. I'm continuing our November issue of Ask a Vet a Question, and my question today comes in from our lovely client Kylie Thompson, who wanted to know whether dogs can get dementia and whether a dog's brain ages similarly to a human's brain. So I suppose first of all, I just want to clarify the term dementia. In human medicine, the term dementia is thrown around quite a lot, and it actually means an umbrella term for a lot of different syndromes, which can be all different, but all seen within this kind of broad brushstroke statement of dementia. But more importantly, one of the diseases in dementia, or under dementia, I should say, is Alzheimer's disease. And we know that Alzheimer's disease is a neurodegenerative disease that affects our ability to retain our memory, also to cognize certain information and then process it and respond in a usual normal manner. And with Alzheimer's disease, it's very similar to what we would term canine cognitive dysfunction syndrome, or for short, so that I don't have to say the mouthful every time, is CCDS. And so definitely dogs can get CCDS, and that in itself is very similar pathologically, or even looking at how our human brains go with Alzheimer's disease in terms of the dogs with CCDS. So first of all, with dogs, from about 7 years of age, we start to see or can see signs of memory decline, and they can start to decrease their ability to learn as well at that age. But it's not until about 11 years of age that we see dogs showing one or multiple further progression of the clinical signs of CCDS. So I just want to go into what the clinical signs of CCDS are so that you can be aware of them, and then I'll talk about what it's important to do once you have seen those clinical signs and why. So the clinical signs of CCDS are commonly remembered by a handy little acronym called DISHA, or DISHA, and that stands for disorientation. So you may see that your dog, as they get older, will start to stand in rooms and kind of stare into the distance, or they'll stand in corners and just kind of look at the wall. I've definitely seen patients that have gone behind couches and don't actually understand how to back out from behind a couch, and owner was finding the dog continually stuck behind the couch. I stands for interaction, so your dog may not be coming up and greeting you when you get home anymore. They may not be behaving similarly to how they used to interact with other family members. S stands for sleep-wake cycle. So sleep-wake cycle basically refers to the fact that you may see your older dogs starting to pace at night or get up and not actually sleep as well as they used to. They may also wake up in the middle of the night and start barking continuously for a little while, and that would be considered unusual if it was an unusual behaviour for them that they didn't normally do. And then H stands for house soiling. So oftentimes as dogs get older, if their memory is affected, they may forget how you once trained them as a puppy to go to the toilet outside. And so we see an increase in occurrence of your dog actually going to the toilet inside in an area which would be seen as unfavourable by us. Now, A is the last one, and that stands for activity, which is where you may see a decrease in their actual want or desire to go outside and play, or to go for walks, and even sometimes to eat their food. So they're the clinical signs that we like to go off for CCDS, and your dog may present with just a few or quite a few, but we do find that the older the dog gets, from kind of 11 years old to 16 years old, or however long they may live past 11 years of age, the clinical signs can increase in the number that they have. Now, the important thing to remember with these clinical signs, and the important thing that we see from our vet's point of view, is that when you bring a dog in with these clinical signs, it can be due to not only the CCDS but also other medical issues or diseases can also occur commonly and cause these clinical signs as well. So I suppose from the point of view of you as pet owners, if you have a dog that's house soiling, for instance, it's important to know that it's not going to mean, oh, it's immediately CCDS. You would bring your dog in and we would do a physical examination to check how they're going. We would also have to run bloods and a urinalysis panel, because something like house soiling, although it can fall under the CCDS clinical signs, it can also be due to a number of other diseases such as incontinence as the dog gets older, renal disease, it can be due to diabetes, it can be due to even osteoarthritis, so where they're not able to comfortably ambulate anymore and get outside to that point where you previously taught them to go to the toilet. So from our point of view, it's important to remember that CCDS, although it can cause a lot of different clinical signs, those clinical signs can also be accounted for from other medical diseases, and so we need to run these tests to make sure that we're not missing a medical disease that we could be treating whilst we are looking for the diagnosis of CCDS. And I suppose an easier way to say that may be that a CCDS is more of a rule out diagnosis, so we have to go through all of the other diseases and make sure that we're ruling those out before we can come to the diagnosis that your dog may have canine cognitive dysfunction syndrome. Now, going on from that, if they do get to the point where we say, oh yeah, they most likely have canine cognitive dysfunction syndrome, the disease itself, like in the humans, is a disease of management. So it's not something that we can absolutely cure, but it is something that we aim to be able to manage and get the dog under control a little bit better from what they are presenting with. So our common I suppose workup and treatment of these dogs would be, once we've worked it up and ruled out other diseases, we would then go on to treatment, and treatment would be ultimately medications that are designed to help increase either blood flow to the brain or increase the actual ability of the brain to retain memory and learning capabilities. And the next thing that we'd also add in would be diet. So it's been proven that antioxidants and also our good fats, the good fats, fatty acids, the DHA, the EPAs, would really help to actually increase the brain's ability to take up information and help it to just learn. And hopefully the medication would decrease the furthering of the disease progression, so that we could ultimately see some of the clinical signs come back a little bit and see that your dog is improving. But yeah, I wanted to come back to Kylie's question here at the end here, because she's written a little bit of a blurb when she wrote the question, and she's said that her old girl is becoming forgetful. For example, she's greeting the kids 2 or 3 times after school, so that would be decreased interaction in terms of what she remembers. So she's going up and she's actually greeting the kids multiple times because she's forgotten that she's greeted them already, and then wanting to go outside and forgetting what for. So that would be the disorientation or confusion clinical sign. And also wandering off when walking around outside. Now that one may be also due to this kind of possibility of having a cognitive dysfunction. But in saying that, exactly like what we've just been through, for a case like Kylie's dog, we'd have to get her in and actually see whether or not she has any other issues going on that could explain those clinical signs. And ultimately you want to rule out all those medical diseases, but you also want to rule out the possibility of there being a mass in the brain that's then affecting the brain directly due to impeding those neuro impulses and also getting information into the brain in that one area. Yeah, so I think that's everything. The take-home points would be that yes, dogs' brains do age similar to humans, not exactly the same but similar. Can they get dementia? Well, they can get CCDS, which is similar to Alzheimer's, which comes under the term of dementia. So in a roundabout way, yes. And it's important, if you are seeing these clinical signs, to bring your dog in, have a chat to us, and if it is an issue, then we'll go through a full workup and make sure that your dog is not suffering from any other medical diseases, and eventually we'll see whether or not they do have CCDS and then help you along on the next step with what to do. Thanks guys for listening. I hope it's been informative and I hope not too repetitive. Have a good rest of your weekend. Bye.